Hello everyone, welcome back to Studious Students. In this video, we'll talk about gastric carcinoma, mainly etiology, morphology, and clinical features. Starting with etiology, which includes H. pylori infection. Funny enough, even H. pylori causes peptic ulcers. To know more about peptic ulcers, do watch my video on it. Next is eating tasty, dried, smoky, and salty food. But why does eating tasty, dried, smoky, and salty food cause cancer? Because in tasty, dried, smoky, and salty food, we have something called nitrates, which converts into a harmful carcinogen called nitrites. On the opposite side, eating healthy, fresh leafy vegetables reduces the risk of gastric carcinoma. Then we have the big bad villains. We have tobacco smoking and alcohol consumption. All increase the risk of gastric carcinoma. If you're Japanese, Korean, Chilean, or pizzeria, that is Italy, you are at a higher risk of developing gastric carcinoma. Whereas if you are from the land of freedom, that is USA, UK, and Canada, you are at a low risk of gastric carcinoma. And if you are black, or you are Native American, or you are from North Wales, you are at a higher risk of developing gastric carcinoma. And finally, if you have blood group A, you are at a higher risk of developing gastric carcinoma. Now coming to the main part, that is morphology. First one we have is early gastric carcinoma. Just remember one point. For microscopy, it shows well differentiated adenocarcinoma, as you can see in this image. For gross, it is most commonly found in the atrium. It can be either polypoid, superficial, or ulcerate, which I'll show in the next slide. The first one is polypoid, which looks like a mushroom. The second one is superficial, which acts like a very small pump. Second one we have is ulcerative carcinoma. It's the most common gastric cancer. It's flat and affects mainly the gastric canal. It is also infiltrating and ulcerative, as you can see in this image. For microscopy, we see signet ring cell adenocarcinoma, and if you follow these black arrows, you will see calcifications. Third one is fungating carcinoma. It is commonly seen in fundus and will look more like a cauliflower, as you can see in this image. Coming to the microscopy of fungating type has papillary adenocarcinoma, as you can see in this image. It is finger-like in shape. Fourth one is Scirrhous carcinoma, and here the stomach wall is thickened and the lumen is reduced. In microscopy, we see the signet ring cells. Fifth one is colloid carcinoma. It has a gelatinous appearance due to secretions of huge quantities of mucus, as it is evident in the microscopy too. And finally, we have ulcer cancer type. It is nothing but tumor formation in ulcer, as you can see in this image. Next one, we have microscopy. This microscopic picture is intestinal type gastric adenocarcinoma because it forms glands. Signet ring cells are not the typical finding here. They are characteristic of the diffuse type of gastric carcinoma. Now coming to the WHO classification, we have four types. First one is tuberous type, which has irregular place adenocarcinoma, as you can see in this picture. Second one is papillary, which looks like a finger. In the third one, we see signet ring cells, and in the fourth one, we see mucus-filled cells. Clinical features include abdominal pain, vomiting, loss of weight/appetite. It also includes malaise and anemia. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to Studious Students. See you in the next video.